Well, look, the Prime Minister in the UK last night gave an address to the nation. He has announced an Omicron emergency boost. A tidal wave of Omicron cases are coming, he says. We all need to get our boosters. We're going to need to do 1 million a day because 2 jabs just isn't enough. This, of course, all based on what could happen. It hasn't actually happened here yet. But, of course, we can learn from what's happened in South Africa. You've had the Omicron variant for 4 weeks. Is that the correct reaction from our Prime Minister?
Well, the correct thing is to get as much people as possible being vaccinated. And if you are due for your booster, go and get your booster. We need to make it clear that we have seen nearly 50-50 at primary healthcare level, whether you're vaccinated or not, whether you had COVID before, whether you had COVID and vaccinated, you still get mild disease. However, the picture in the hospitals with admission there is different. The majority, about 80, 88, 87, depending on which stats you look at, are mostly unvaccinated people. Unfortunately, we're not sure of those unvaccinated people in ICU who is there primarily because of Delta or Omicron. Our labs need to start to give us the breakdown. Is it Omicron or Delta, so that we can assess the severity? But as far as I know, there was no yet cases related to Omicron, solely to Omicron,
right,
that of people dying.
And this is it. No one, as far as we're aware, official statistics, no one anywhere in the world has yet died of Omicron. Now, okay, we have a time lag on deaths, so that it may well be that happens. But the fear about this variant has been that it could evade vaccines, that it was much more transmissible, and therefore far more people could get infected at any one time. And just as a matter of odds, even if it's not more severe, more people could end up in hospital, more people needing ICU. But in South Africa, I understand that actually, even though you are in another wave, your 4th wave of the virus, you are not seeing a greater proportion of people going into hospital, going into ICU, or thankfully dying.
Yes, you are 100% correct. Although our scientists still cautious as to say, please, wait another week to see whether there would be cytokine storms that we have seen with Delta. But I can promise you this is not the same than Delta. And the clinical picture at primary healthcare level, that of mild disease, about 5 days, and then full recovery. We haven't seen any long COVID side effects as yet. It's not to say that it won't start, but for now, the average patient will be suffering from a headache, myalgia, body aches and pains, and fatigue or the tiredness. And we are advising our people, if you have that, please go and get tested. But what I have also seen is if you wake up this morning with your body aches and pain and your headache, not feeling, feeling under the weather, wait 24 hours if you want to do the rapid test. I have found 1 or 2, if you wake up that morning, you come immediately for the test, that it's still false negative. But otherwise from day 1, 24 hours later, we see that it's positive up until really 6 days. We've got a policy that after 6 days, between 5 and 6 days, we will send for a PCR. But it's been, the PCR and the rapid test is quite sufficient to pick up the symptoms.
And has South Africa introduced new measures to tackle COVID, to restrict people's freedoms as a result of the Omicron variant?
No, we haven't. We're still at the same level lockdown that we have been for the past few months.
And what level is that? What sort of restrictions are there?
It's restrictions around gatherings, 2,500 people outside, in a rugby match or whatever the outdoorsy requires, and then in-house. I'm not sure about that, but it's about, I think, also around about 1,000 people in-house, depending on whether, or 50%.
But in terms of normal daily life, going to work, people meeting their families and socialising, that is still all going on.
Yeah, nothing changed
In
there.
a largely unvaccinated country, and you've not seen a single death from Omicron.
No, we have not seen a single death, and we have not put anyone at primary healthcare level on oxygen. There's no need for oxygen. I think if you come from a Delta and wave, and everyone was, yes, we were all very, very worried with the Omicron because of these mutations, and we didn't know what to expect. And but as I've said, 4 weeks now. This is now going into our 4th week. We are quite confident that the majority of patients are, 5 days, as I've said. And this is now one of the other problems, is they don't want to quarantine or isolate for 10 days because they are feeling fine. Can't understand this.
Yeah, indeed. And again, in this country, you can have no symptoms at all. You're still required to quarantine for 10 days, but people probably are rather less stricken by poverty, as many in South Africa, and many particularly in the area where you work outside Johannesburg. In terms of the government in the UK and what we're doing here, this is all being based on the computer modelling, the mathematical modelling of what could happen in the event of widespread Omicron cases. We've had a prediction of 1 million cases a day by the end of the year from our Health Secretary, Sajid Javid. Looking at that versus what you have seen on the ground as a doctor dealing with this 4 weeks into the Omicron variant being widespread in South Africa, what do you make of the decision to look at that mathematical modelling as opposed to what's happened on the ground in South Africa?
So I'm always saying, we need the science. The science is very, very important. We can't be without the science. But at the end of the day, I'm dealing with the patient sitting right in front of me. The patient that doesn't have a clue what the modelers are saying. The virus doesn't have a clue. So you deal with the real life case, and dealing with the real life cases at this stage. Yes, you can have 1 million people maybe getting positive. But as long as the real patients sitting in front of you have a mild disease, your system will not be overrun.
Really good to talk to Dr. Angelique Coetzee. I'll let you get back to your patients in your surgery there. People will be ringing up